Hi there, I'm Dr. Gretchen, physical therapist and multiple sclerosis certified specialist. Today, I want to talk to you about one of the most common symptoms that is associated with multiple sclerosis weakness, and that is drop foot, also known as foot drop, foot drag, foot slap. There's lots of names for it, but essentially what it is weakness and or muscle tightness in the ankle and foot, potentially the calf as well. And when that manifests, it forces your foot to drop. And one way that you'll know this is if you trip a lot. But I wanted to call something to your attention because some people with multiple sclerosis know that they have drop foot, but others have it but have no idea that they have it. So I wanted to give you a way where you can test by looking at your shoes to see if you may have drop foot. So you're going to grab any pair of shoes. It could be sneakers, it could be sandals, a pair of boots, but ideally they are shoes that you wear frequently. If they are brand new shoes, this won't work that well. You want to choose something that you wear often. So I'm just going to demonstrate with one shoe for now, but then I'll bring the other one back. What you're going to be looking for in your shoes is any signs of wear and tear in specific spots. The first place I want to look is the very front of the shoe. And again, we're just looking for wear and tear. Are the lines or dots or whatever the design was that was initially there, is it still there? And if so, is it equally across the entire front of the shoe? Or is it more worn out on this side or on this side, or maybe right in the center? Then you're going to look for the same thing, the wear and tear, the loss of the design on the bottom of the shoe up towards the top. So anywhere in this area is fair game here. What this would indicate, if you had wear and tear in this area, is as you're walking, you scuff your foot right in that area. If you have wear and tear here, what that indicates is that when you're walking, you're scuffing the top of your shoe. These are the two most likely spots where you would notice wear and tear associated with drop foot or foot drop. And some people will even have holes in these areas. There will be a hole in their shoe here or here. And I've had a lot of clients and Missing Link members say that they actually need to get new shoes at least once every 6 months or once every year because of the wear and tear. And they didn't know that it was related to drop foot. So those are two locations you can look at. Another location is going to be the outside. So this would be the side of my pinky toe. This would be the side of my big toe, the instep. So you want to look on the outside of the front quarter of the shoe, and you're just going to look for any wear and tear on the outside here or right on the bottom of the outside of the shoe. And same thing, we're looking, are the lines that were initially there, are they still there? Is there wear and tear? If so, is it more here or here? We're trying to get pretty specific. And then same idea, but over on this side. So more on the instep where your big toe would be. Do you have any wear and tear on this side of your shoe? And also look towards the bottom. Now, if you do, this would indicate that your foot, when you're walking, your foot might be falling inward. Whereas wear and tear on the outside here might indicate that when you're walking, you might be landing more on the pinky side of your foot. So just simply looking at these few locations and looking for the wear and tear there can explain how and why you might be walking in a certain way. And the reason this is important is because if you do notice wear and tear in any of these areas, that can lead you towards knowing what exercises to do. For example, if you have wear and tear on the front, so the front here or the bottom, that would be our ankle dorsiflexion exercises and calf stretch. So the ankle dorsiflexion exercise is when your heel stays down on the floor, but you attempt to lift your forefoot up and then lower it down. Lifting it as high as you can, even if it's only 1 centimeter or a half a centimeter, and you would do the same thing on both sides. So that would be the ankle dorsiflexion exercise to strengthen the front of your shin. The other thing that you can do for wear and tear here would be a calf stretch, which is your classic stretch of the back of your lower leg. You can do that seated or standing. We've done several of those options in our live classes for Function First. If you have wear and tear on the outside of your foot, that might be a sign that you'd want to do what I call ankle eversion exercises, where you're practicing moving your foot slightly out to the side, then back to the center, then slightly out, then back to the center. Or perhaps it's not moving it out to the side, but you're trying to lift the pinky side of your foot up and then down, and then up and down. There's a few different ways to do it, but we're just trying to activate the muscles on the outside of your calf. Now, if you have wear and tear on the inside, we'd want to do the opposite. That would indicate that your foot is falling inward. So we would want to practice lifting the inside of your foot up and then down, up and down, and you would be using your ankle and calf muscles to do those actions. So the first thing is becoming aware that you actually have drop foot and that you have this wear and tear. And then the second thing is to use that to help you understand what exercises you should be doing. The last thing I want to say is that it's important to compare both sides. Is this wear and tear happening on the right side and on the left side? Is it one more than the other? Does one not have any signs of wear and tear? So comparing one to the other, just so you're aware of what's happening with your feet. And finally, I will say that I do have some wear and tear, not specifically on these shoes, but I have wear and tear on my shoes, and I do not have multiple sclerosis. So wear and tear does not necessarily indicate that you have MS and you have foot drop. It's just that if you do have foot drop, this is almost always something that you will see. And even if you don't have foot drop, but you have wear and tear, these exercises that I mentioned can still be beneficial. So I hope you found this informative. I hope you go ahead and grab some of your shoes, maybe all the pair of shoes that you wear, and just check them out and then do the appropriate exercises based on what you find. Thanks for tuning in. If you'd like to find more information, you can always find me on my YouTube channel, which is Dr. Gretchen Hawley, or on my Instagram, which is Dr.Gretchen.